Welcome back to the Healing Wellness Show, where we're going to be exploring evidence-based ways to move, feel, and live better. I'm your host, Dr. Karim, and if you're dealing with stubborn, I would say tendon pain, plantar fasciitis, or chronic musculoskeletal issues, then today's episode is going to be for you. Today, I'm joined by Dr. Brian. He's a clinician who's helped countless of patients return to work or sports, and it's using a technology, shockwave therapy. It's a non-invasive treatment that stimulates the body's own repair mechanism. So we're going to cover the what shockwave is, what a session feels like, and what you need to know about it, and if you're going to be a good candidate or not. So with me today, Dr. Brian, I'd like to welcome you to the show. For those who are first time listening to Dr. Brian or don't know Dr. Brian, please tell us a little bit about you.
All right. Well, I'm a second generation chiropractor. My dad was a chiropractor for almost 50 years. I've been doing it for 28 years. I came from Life University. We do a very subluxation based office. A lot of things that typical chiropractors take care of, but we're always looking to improve the outcomes of our patients, and we run into things that are difficult to fix. We try to look for new solutions. And some of the problems nowadays is that you've got the old school thought, which is chiropractic is a hands-on only procedure. And then you've got a lot of this new technology coming up, red light therapy, shockwave therapy. You've got these different types of techniques. And some people are hesitant to bridge the gap between the old school and the new school. And this was me in the beginning. But when you run into so many chronic shoulder problems, hip problems, knee problems, plantar fasciitis, anything tendon, even neuropathy, you're looking for better outcomes for your patients. So, a lot of times as doctors, we run into problems. Like my story is I hurt my knee being a little bit of a fool on a trampoline and showing off in front of my kids. And I felt this, and it was probably a meniscus. And I went to my local orthopedic doctor and I was asking him about my options. And he happened to be a workout buddy of mine. And I'm like, what are some of the new things that they're doing? Because I suffered through this long enough. I tried chiropractic care, little electric stim, the normal stuff that we do. But with chronic, tough to fix problems that are deeper down, sometimes you can't fix them. So he's like, hey, they're doing this new thing, this extracorporeal shockwave therapy. And I'm like, what is that? So I reached out to a local chiropractor up near Boston who was the closest guy I could find doing this. And I went up to his office. He did a couple sessions on me. I paid him, and he was nice enough to go over some of this with me. And the first day I walked out of there so much better after suffering for almost a year. And I'm like, I have to have one of these in my office.
That's awesome. That's awesome. So in plain English, dumb it down for us. What is shockwave therapy and what problems does it solve?
All right. Well, you could call it a soft tissue rejuvenator in plain English. That's very simple. Some people, I'm a member of the American Society for Medical Shockwave Therapy. I've been to a lot of seminars with orthopedic surgeons, orthopedic doctors. It's more integrated in Europe. It started in lithroscopy for kidney problems when they had kidney stones. And they used to blast these people with these sound waves, but, it was in water with these big tubes that would blast these kidney stones out of there. But they would, in the beginning, they didn't have the technology. It was doing damage to other things. But what they did notice is that people's hip flexors, people's soft tissue started getting better in the people who had these kidney stones. And they started figuring out, can we fine tune this technology to try to help people with soft tissue injuries? And they wanted to look in the mechanism. How does it fix soft tissue injuries? Well, these shock waves are almost like the sound waves an airplane makes when it's going several thousand miles an hour. These sound waves create energy and they go through the cells, and they think that they break up the scar tissue in the cells. So it's a non-invasive sound wave treatment that reduces inflammation, it breaks up scar tissue, and it helps the rejuvenation process. What they think it does is that it breaks down the bad stuff in plain English, and it invites in the immune system afterward to repair the damage. So it doesn't create stem cells, it stimulates the immigration of stem cells, which helps to repair damaged tissue, but it can get to where it needs to go, because a lot of times if you have a problem in your knee and your shoulder and your foot, it's deeper down than a surface treatment can get to. So it goes deeper into, it can go 2, 3, 4 inches into the tissue, and they think it's a biological stimulator. It stimulates anything that it touches at the cellular level. They think it improves ATP production, cellular membrane permeability, and all these things that we don't even know about that helps the healing process along. It's non-invasive. It can, a lot of these chronic, pesky, troublesome injuries that affect the quality of people's lives, I've seen a huge difference in those people with this.
So how would you say this is different from like other devices out there that, you see at other chiropractic offices like ultrasound, laser, you name it. There's multiple.
Well, ultrasound is for imaging. I mean, it takes a village to help people. I'm not going to say that one thing cures all. Sometimes we need the integration of a cold laser with the shockwave therapy, with traditional chiropractic to get blood flow. And it's kind of like it's like when those things mix together, you get a healing process that occurs. So I'm not going to say it's better than anything else out there, but it's gotten results that I've seen that other places haven't gotten. And I would say that it's very non-invasive. It's very effective. The other thing is it takes the guesswork out. When these shockwaves hit the area that it needs, you start to feel it. You feel this pressure that's building up, and the patient gives you the biofeedback of where this thing needs to be put. So you don't need to be a genius to use this thing. I mean, technically you could get someone who's 20 years old who takes some ultrasound gel, rubs it around. When they hit the spot and they keep it there, it starts the healing process in that area. Now, we like to have x-rays. We like to have an ultrasound view or an MRI of the area. We get a lot of referrals from orthopedic doctors. We do a range of motion, a thorough exam, but it's non-invasive. It's very effective, and the patients can feel immediate results. I've not seen treatments that can get like someone who's had a knee replacement and suffered for a year or two. Well, this was my patient on Monday night. This young kid who's a firefighter, he came in and he's had pain for like 3 years. He tore his ACL and had a meniscus replacement about 3 years ago, and he suffered for the last 2 to 3 years, continually getting worse, not good range of motion, really tight, a lot of pain, especially even putting pressure on it in his sleep with the blankets on his body. He can't bend his knees and bend down very easily. And after the 20-minute treatment that Monday night, he was already bending down all the way. He said, I haven't done this in 3 years. I haven't even been able to do a squat and not be in pain. This is amazing. I can't believe it. And they walk out instantly.
Yeah, that's amazing. So why do some patients feel relief quickly while others it may take a few sessions?
Well, it depends on the age, how long something's been there, and people's healing. Like kind of say it's like an onion. You have layers of tissue that build up. So scar tissue builds up in layers over time. And sometimes if you have a real rotten onion, you have to go through several different layers to get to it. And that's what the problem is sometimes, is that some cases take longer. If it's deeper, if it's been there longer, if there's more scar tissue, it's going to take longer. And of course, how healthy someone is when they come into your office. So, if you're overweight, if you've got pre-diabetes or insulin resistance problems, if you've got a lot of toxic inflammation in your body, how old you are, how active, how well you sleep, how healthy you are, basically determines how fast you're going to heal. So people that aren't as healthy are going to take longer to heal. And that's why in the beginning, we kind of do a sample session for a discounted price so I can get a better idea from the first visit of how long it's going to take for people to get better. But that's an excellent question.
So what would be a realistic expectation week by week?
Week by week. Well, week by week, a lot of times people will see 20, 30% difference right off the bat in the first week. And probably by the 3 to 6 sessions, you'll probably have at least a 50 to 70% improvement, if not more. And here's the interesting part, is that some people heal differently. Like shockwaves break up scar tissue and they reduce inflammation at the cellular level, but now the body's got to heal. So sometimes people don't feel any difference after 3 to 6 visits, but after 4 to 6 weeks after the treatment's over, when the body starts to repair and heal, a lot of times they feel a lot of difference. So I don't try to misguide my patients by saying, oh, we're going to instantly fix your problem, that this is just like in chiropractic. It's going to be a healing process and it could take some time to heal.
So what would you say are like your top 5 conditions that you treat most?
I would say, plantar fasciitis. I would say, knee problems like meniscus problems, bursitis in the shoulders, hip bursitis / sciatica, because a lot of times when there's swelling in the hip, it can affect the sciatic nerve. And I would say elbow problems, but we see a lot of wrist problems and foot problems as well. Gout, people who have had, that helps to break up. We've seen some neuropathy, Morton's neuroma and neuropathies. We have seen some interesting things. I had a girl with a Liz Frank fracture come in, had it not healed properly after 2 years and was referred to our office. And she had pain in her foot, but one foot was like really discolored, almost purple, like it had hypoxia, not getting enough oxygen compared to the other foot. And we were trying to treat her foot for the pain that was in the side of her foot. She came in after 3 visits and said, look at my foot. It's cleared out. I've gone to Mass General up in Boston. I went everywhere. They could not figure out why my foot had this purple discoloration. It was cold. It opened up the blood vessels. So a shockwave doesn't only affect tendons and ligament. It affects blood flow. It affects nerve flow. It can decalcify nerves. It can vasodilate blood vessels that are clogged up. So all these different things and applications that it has. And now, they have new research coming out in Europe. It's not here yet, of even neuroregeneration. They're coming out with units that can break up plaque in the brain for dementia and Parkinson's. Some urologists are using it for, ED dysfunction and fertility clinics. So it seems like it's a biological stimulator, and whatever kind of soft tissue that it hits, it can help to bring it back to life and improve its function. So they're finding all kinds of clinical applications. They just need the research to match the findings that they're happening for it to come out to the mainstream.
So who should not get shockwave? And what are
there's
go ahead.
Contradictions.
Yeah.
Now you're talking about contradictions. Yep. All right. So since it's a biological stimulator, contradictions are things like an active infection in the area, if they have cancer in the area that you're doing on. And pacemakers, neurostimulators are definitely contradictions. And then, you got to be careful on people on blood thinners, because there is some bruising involved. If you have it on a light setting, from what the head scientists in Germany and the medical doctor and the orthopedic surgeon said that on a lighter setting, yes, you could do that on people, but you want to stay away from cavitations. You don't want to put it over the lungs. You don't want to put it over areas that have cavitations. They used to, from what I was told at the seminar, and this is what I was looking at for clarity, because there's a lot of unknowns out there, is they thought that it might affect growth centers in the bones, but at light settings, they said it does not affect growth plates. So kids under 18 used to be a contradiction, and now they've taken that off and they said that they are safe and effective. So we're seeing a lot of young athletes. And I used to think that prosthetics were contradictions. It's a sound wave. It's not electrical. It does not heat up the prosthetics. So I was told that it's safe and effective. And we've had a lot of people with hip replacements and knee replacements and that have had very good results. And the reason that is that they replaced the joint that's damaged, but the ligaments and the tendons and the muscles in there are still damaged. I mean, I had a guy who was a rock climber who couldn't climb anymore because his hands and his elbows were hurting and his shoulders were hurting so bad. And he was a guitar player in a band and he couldn't play anymore. And he came in and asked me, and we worked on his wrists and his elbow and shoulder, and he's back to rock climbing. He goes in and he sets up the rock climbing place and grades the level of difficulty. And this guy has got his life back. He's so happy. He comes from Providence and he's just ecstatic.
So why don't you walk us through what a typical visit would look like?
Well, the first visit is we do a history. We do an exam with orthopedic tests, maybe reflexes. Make sure that, just like in any patient we have, we want to make sure that the treatment's going to be safe and effective, and we want to have a history, some imaging, hopefully an X-ray, an MRI, an ultrasound. A lot of my patients are referred by orthopedic doctors in the area. They've already had their X-rays and their ultrasounds, or they know where there's a tear or there's a calcification in this area. Now we can really zoom in on that. And we do an exam. We do a consultation form, an informed consent, a contradiction form. And we do go over if they have any questions, and we tell them what to expect, and then we start working on them. We have a gel heater, and I find that there's a lot of different protocols out there, but there was not a lot of, I paid for a lot of these educational seminars, and this is what I'm looking to create soon, is more of a clinical experience, like how to get this thing started from the ground up. Do you need a gel warmer? What kind of equipment do you need? Do you need anything else on the table? What kind of exam forms do you need? And then what kind of treatments? A lot of the difficulty that people have is they come in, let's say your shoulder hurts up in here, and it's where the AC joint is and a rotator. Well, a lot of times this machine gives you biofeedback. When you're over that, you don't feel it so much. But if you start exploring around other areas like the bicep tendon, I find that that's where about 50% of chronic shoulder problems come from, is the bicep tendon has a problem with it. And you have to go, just like, sometimes it's L2 that's causing sciatica and not L5 or the pelvis. We have to look into other areas. And right now, it's not very clear. There's not a lot of information or seminars or classes that go over some of these protocols of what you found after a year of work. I've had, well over 400 clients total in my office in the last year, and it just keeps getting more. I had to hire a tech. Now I'm looking for another tech, and we're getting tons of referrals. That's one of the things that I know that it's working, Dr. Mo, is because people are referring. The people leave, they go tell all their friends and all these people coming in. When you have to market them a lot, are they really working? We all know in our clinics, the best feedback we can get on the effectiveness of our treatment is how many referrals, are people talking about it. We get tons of referrals from this because people go out and they're like, they were walking on crutches and a cane 2 weeks ago, and now they're walking around. So it's been an amazing thing that people are just telling their friends about it. They're excited about it. And that energy that comes into the practice, here's the interesting part. We're getting a lot of people who don't go to chiropractors come into the office, and a lot of them become chiropractic patients when they hear the chiropractic story. So it's building the chiropractic office. So a lot of these patients are becoming patients because I think it's important to have the nervous system balanced in any person, especially if you're trying to heal an area. And we're getting vice versa. A lot of the patients that come for chiropractic are getting Shockwave, and a lot of the Shockwave patients who aren't chiropractic patients are becoming chiropractic patients. So it's been an amazing journey, and it just keeps getting better and better.
So how many sessions do you typically recommend, and how far apart?
All right, once a week. The sessions are about once every week, because you want to give the immune system and the tissue time to repair itself. So you wouldn't want to overdo it. So usually, depending on how the first visit goes, so we do a discounted first visit, and we do a session, an exploratory session. This gives the patient an indication of how effective the treatment is. It gives the doctor feedback of, if they walk out and they're 30-40% better, they probably need 3-4 visits, and we do it for 3-4 weeks in a row, and then we give it 4 to 6 weeks to heal, and we see how it's going. And if they need more, they can have more. Now, on chronic, more like if you have frozen shoulders or you have multiple areas, a lot of times they buy a package of 6 visits, and they might do 3 for the left shoulder, 3 for the right shoulder. They might need like 5 or 6 for one side. I had a guy who had a non-union fracture from an old hockey injury, and he couldn't play pickleball, he couldn't play golf, he couldn't play hockey. He suffered for a couple years. I think he took about 14 or 15 visits to get right, but now he's out running again. He's functioning. Some of that bone is starting to grow back a little bit because he had gone to Mass General. He had gone up to a hospital, the one, New England Baptist, where a lot of extremity problems in Massachusetts happen. A lot of people go get hip replacements, knee replacements there. He had gotten tests up in there and it wasn't healing and it was affecting him. He wasn't able to enjoy his life. And after that one was like the most I've ever had, like 15, 16 sessions. And he is so much better that he's out playing hockey, running, playing golf without restrictions. He's very happy.
So what should patients do or avoid between these sessions?
Well, they should treat it like a good workout. What you want to do afterward is drink water with electrolytes. I recommend some apple cider vinegar with water to flush the toxins out of the body after your body's had a treatment. Creatine or collagen. Take some green tea. Things that bring down inflammation and help repair the tissue, just like you would do after a good workout. And some of the things, there is really no downtime, but you got to use common sense. If that area is sensitive, give it some time to heal and rest. But if it's not, the one thing I found is that some people feel so much better and they've been so restricted, they go out and overdo it and they aggravate it again. So I would say that you got to use common sense and have some downtime. But if people worked on their lifestyle, they cleaned up their diet, they worked on eating more vegetables, more clean protein like collagen or creatine, digestive enzymes, probiotics, things to reduce inflammation while their healing is going to be faster and it's going to be more effective.
So is there a difference if, say, progressing an athlete versus, like, say, someone's a desk worker?
Yes, it's definitely a difference. I mean, we know that athletes have motivation to get better, and sometimes desk workers don't have that as much, but people that were healthy before tend to heal faster usually, but some athletes have more damage because they are more active. It's kind of like you can never tell. I had a girl with frozen shoulders that could barely move her shoulders up, and she couldn't even bring it up to here. And after one visit, she was doing like this. And I was even in disbelief. I did not expect that. And then I have some people that are in good health and good shape, but just have had a chronic problem in that area, and they take longer to heal. But that's a great question.
So what are some of the myths that you would say about Shockwave? So, for example, it's painful, or it's one and done fix, or it's just a massage gun.
It's not a massage gun. The massage gun is more on the surface, and the massage is just loosening up the muscles. I mean, what this is trying to do is change the way your body functions at the cellular level. It's affecting your cell membrane permeability, which allows the nutrients in and the toxins out. It's a much deeper treatment and it's more of a permanent. It's not like a quick fix. You're trying to get to the real cause of the problem, which is the tissue's not getting enough blood flow. It's not getting enough nerve flow, and it's got scar tissue and it's healed the wrong way. And in order to make that tissue function again, the cells, you need to break up that scar tissue. So the myth is that it's a quick fix. Sometimes it is, sometimes it isn't. It's more permanent results. It's not just like a shot where the pain goes away and it comes back. A lot of times you're seeing some of the people I had for plantar fasciitis had 3 visits and they still are patients in my office and it hasn't come back and they suffered for years. It's not a quick fix. It's non-invasive. Now, let's go over the pressure or the pain part. It is a pain. There is discomfort involved, but I call it discomfort over pain because the minute you shut it off, the pain goes away. But it's giving you the biofeedback to show you where to put this device. So when it's on the area that shockwave beam is focusing on, you will really feel it, but it starts to break it up. And the interesting part is that as people come in, we do it on low settings in the beginning, and there might be a 6 or a 7. And I always have the patients tell me, we want to be around a 5 or a 6 in discomfort. You give me feedback and they'll tell me like in this area, like, all right, we're like a 2 or a 3, or I don't feel it. And all of a sudden, wow, that's an 8 or a 9. The longer they can handle that discomfort, the more it's breaking it up in that area. And the interesting part is we could put it on a 0.2, a 0.05 microjoule to start, and it feels like a 9. 3 sessions later, we're on a 0.15 microjoule or a zero point 0.2 microjoule, and they don't feel it as much. So it is, a lot of times they won't feel it at all. Or they'll say, does this hurt everywhere? And then you put it on the other shoulder or somewhere else, they don't feel nothing. So there is discomfort and pain involved, but it's beneficial because it gives you feedback and you can lower the settings. And of course, you got to give people a break in the sessions. Usually in the device that I have, it's like at 1,000 clicks, it tells you break time and it shuts off. And then you can do it again.
So how would you frame Shockwave versus someone that says, hey, I want to do injections or surgery?
Well,
If it's
we
right.
always want to go for, yeah, we always want to go from non-invasive to more invasive. And we want more permanent fixes. Just like as chiropractors, we want to try to get to the cause of people's problem. And so I think that, there's a lot more risk to injecting areas with cortisone than you can hit a nerve. It'll numb the area, but will it really fix the problem? Because afterward, the problem is still there. So I would rather go from less invasive to more invasive. There are benefits to all of those things, but I think we should always start with a safer, more effective. There's no injections involved in this. It's very safe and effective. It gives you biofeedback to where the problem is. And it also gives you a good indication of how people's outcomes are going to be, because right from the start, if they start to feel better, you know that this is being effective on them. And then, having hundreds of people in my office, and the feedback that I've gotten from them is that it's changed their life. They feel amazing. They don't have to take medication. Some people are sensitive to medications. Some people have found them not effective. And then sometimes if you numb the pain, but don't really fix the problem, you can hurt that area worse, because your body's not giving you the feedback. The pain is there to help prevent you from making it worse. And if you don't get to that, what's causing the pain, then I think that you're doing the patient an injustice or a disservice.
So you've touched base earlier about how long the results last, but is there any consideration about like doing a maintenance care for any reason?
I think there is. I think that's a great question. I think that some people know when it starts to flare up again, like certain times of the year, when I see the change of seasons, when you go from like winter to spring, and from like August, September to October, you see a lot more tendinitises and bursitis, because in where I live in New England, it starts to get colder. Things start to tighten up. In the summer, things are looser. And so some people will come in for a session or two, a touch-up session, but they don't need a lot of them. And once you've done it, it seems to be more effective. But there is some people that swear by the maintenance sessions that it's really helping them, and they don't want to go back to their old self, especially if they're active. I have a lot of people who play hockey, who are active runners, soccer players, football players, cross country are active runners, CrossFit people. They seem to do better, and they've had old injuries that are lingering. They want to have the better quality of life. So they come in for maintenance, and it's been very effective, and they have no problem paying out of their pocket for this, because it's getting results that they couldn't get anywhere else. A lot of people have done physical therapy. A lot of people have done cortisone. They've done, ultrasound, they've done cold laser, they've done different types of red light therapy, and this has been very, very effective. I'm not seeing anything like it, to be honest, Dr. Mo.
So what should listeners know about pricing packages and measuring the value beyond the price tag?
Well, the price tag is, what is it costing in your quality of life? Physical therapy, going to doctors, not being able to enjoy your life has a cost on it as well. I mean, I have had people come in. There was a girl with some knee problems who said that she had spent a lot of money on physical therapy and all these other therapies and massage therapy. And a lot of people don't mind paying the money if they could get the results. So the packages in our office, like we do a $70 for the first visit. We do $500 for 3 visits, $900 for 6 visits, and $1,400 for 10 visits. And I let people prorate those packages. If 3 isn't enough and they wanted to buy the 6, I don't care if we just prorate it and compare it to the normal $900 if they paid the 500 at first. I'm in the business to help people. I'm not in it to like pinch pennies and whatnot. But people have no problem investing in themselves, especially if they've tried a lot of different things. I mean, people, if you worked for 30, 40 years in your life and you've made a lot of money and your quality of life and you've retired with good money, or you're actively working and you're in agony when you're sitting down, and every time you go to lay down and you bend your knee that it hurts and you can't even sleep at night, that could affect you a lot. If you go to get surgery and you're out of work for weeks and it hurts, or there's an active infection, how much is that going to cost you? So this is actually an investment, not just an expense. And a lot of people I found have no problem investing in treatments like this because they're very effective. They get results and it's changed the way their life is. So I have found that the price is not an issue. And for people listening in, like, I find that it's your intention. A lot of people, if you're confident that your treatment is effective, people have no problem investing in it. And we're not big sales pushy. I ask people what they want. And I ask them if they thought the first session was effective, and a lot of people will buy 3 or 6 sessions, no problem. And they're very happy they did. I have lots of testimonials. I have video testimonials on my Facebook page. I have tons more in my phone from people that were happy to share me the results. And it's literally changing their life. And you know, a lot of people will come in and say, I've spent $900 on a lot worse things.
Yeah, I mean, that price tag isn't expensive at all. I mean, so people spend that on, you know, like Christmas coming up, or, spend it on
Right.
like normal everyday things. I always say, you're not spending it on an object, you're spending it on your health. You only have one. You can't replace it.
You on
Just gotta work on it. But yeah, I mean, those
Right.
are
And let's say you can't go to work. Let's say you keep calling in sick. You're a waitress and you carry it. If you can't go to work because it hurts, you can't make money.
yeah,
Or
exactly.
people that are on
Costs
their
you
feet all
more
day as
money.
nurses. There
Yeah.
you go,
Costs,
doc.
yeah.
You got it.
All right. So I've got a few questions that popped up as we're talking here from the
Okay.
audience. So I'll just ask you a few of those. I've got one here from Tom. He said, "Is there downtime? Can I work the next day?"
Yes. Tom, you can work the next day. There is no downtime. I mean, sometimes there's a little bit of swelling or discomfort in the area, but usually you feel a lot better right after the first treatment. So I tell my patients there is no downtime. Some people leave my office and they go out and play golf, or they go the next day and play pickleball, or they go to their office for sure. And if they do the right things, put a little ice on it, drink some electrolytes and water, flush out some of the toxins, that helps the body heal faster. So no, there is really not a lot of downtime. But if you've had, a knee replacement, if you've had, in Europe, at least the doctors that I went to the seminar said they can, in Germany, in parts of Germany, they could sue the doctor if he doesn't offer it pre and post surgery, because the outcomes are so much better after surgeries that get it before they go to surgery and afterward. That's crazy.
It is crazy. I've got another question here from April. Says, "Will it help if my MRI shows a tear?"
Yeah, it depends where the tear is, but what that does is it helps to break down the tissue and rejuvenate it. Now, sometimes it reduces the inflammation enough to make, sometimes people have tears that don't hurt. When the tendon or the ligament gets damaged because the tear weakens things and it starts to rub together, you could cause scar tissue in other places that it might not even be the tear that's causing that. But it's definitely, we have a lot of referrals from our local orthopedic doctors with rotator cuff tears, torn meniscuses, different types of tears on there, tears in calf and quad muscles. And there's definitely a lot of science behind it that it helps to repair things. Even I was told that even bone fractures can help heal faster. I had a podiatrist show me a picture of a guy that dropped a 120-pound weight on his toe, and they thought he was going to have to amputate it. And they started putting the Shockwave on there, and the nail and the bone healed a lot faster.
Yeah, Shockwave is actually being used right now for wound care. So wounds aren't
Yes.
healing.
Yep.
Yeah. We'll take one last question here from John. Says, can I use my HSA, FSA, and what about insurance?
Yes. Insurance is not cover. Health insurance doesn't cover this, but the health savings account and the flexible spending accounts, we're a doctor's office. So absolutely, a lot of people take advantage and find that that's a great investment to invest their health or flexible savings accounts in their health versus other things. And they are very happy. And the funny part is they come in for one thing. Like I had a girl use her FSA. She bought a 10 pack because she was going to use it for some different one area, but it healed so fast. She's like, I want it done on my toes now. I want it done on my knee. And she went through her body and she's amazed at how much better her whole body feels after doing that. So absolutely. And insurance doesn't cover this right now. It's got the FDA one approval. It needs 3 steps to approve for health insurance. You need it to be safe and effective. They've already found out that Shockwave for plantar fasciitis is safe and effective. They have to do the research on it, which they have to get the money to do that. And then it has to have ICD 9 or 10 codes that approve it. Right now, they're not at that, but I believe in the future with enough people seeing the results that this might become insurance approved. Doesn't matter. Insurance isn't supposed to make you healthy anyway. You got to invest in your own health.
Correct. Dr. Brian, I know you've shared lots of success stories, but is there one that just stands out to you that you can share with us?
Let me see. Is there one?
Maybe like a
Well, I mean, there
bizarre
was this.
one or a tough one, like
Well, like
something
I said,
really
that one
sticks.
bizarre one was the foot one, the purple foot one. This girl's foot was not healing, and it was getting better. And there was that hockey injury for the Liz Frank fracture. Well, there was one that this one girl, like she had an artificial hip and she couldn't move it. It was still stuck and clicking, and they thought they had to go back in and do it again. And I guess it was the ligaments and the tendons that were so tight, and we started working on it, and not only did she get her mobility back, but she kept having this clicking sound all the time, and that went away too. And she thought it was that the hip was in the wrong place, but it turned out it was the ligaments of the tendons rubbing over the prosthetic, and just crazy. It was like every time she got up to go to the bathroom, you could hear the click, 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 and her husband kept getting upset and went away. So I guess that's more of a funny one to share.
Yeah, I mean, if it was annoying and went away, that I mean helps the marriage. You help their marriage.
Yeah, yeah.
Any
I'm
last thoughts or comments that you want to share with our listeners?
Yeah, I mean, you got to use common sense, but this is something that's even, it's been out for a while. Shockwave therapy has been out for over 10 years. It's just not been mainstream, and it's very effective. It's very safe when done properly. And I think that if you're on the fence about it, I think you should at least find someone and try it, because this could really change the way your life is on so many different levels that you won't be disappointed that you tried it. And we got to try new things. And we got to sometimes we got to it takes a village. We got to use all the tools in our arsenal to fix things. And this is another tool that I'm so happy that I integrated into my office, and all the people that are so happy afterward and share with me that they got their life back. They were walking around with a cane. They were walking around on crutches, which was hurting their underarms, hurting their shoulders because of their knee problem, and they got their life back. So why suffer when you can try something that can possibly change your life? That's what I hope to accomplish from this podcast. And I appreciate Dr. Mo inviting me on and letting me share some of my information with people. And I hope that, information for information's sake is worthless. You've got to apply it if you're going to get the results. You got to do the work. So that's what I would say, is to take action. Don't get action paralysis. Go find someone, try this out, and see how safe and effective it is. And I bet you I would love to hear some feedback in the future on this link and podcast to see how effective it was. But I appreciate you for inviting me on, and I appreciate you for, trying to educate people and get the community together. I'm with a lot of love, Dr. Mo. Thank you.
Thank you again, Dr. Brian, for joining us today and sharing your knowledge and expertise with us. Thanks for bringing the clarity today. If you learned something today, share this episode with a friend, a family member, or someone battling a stubborn pain. For consults or to see if shockwave therapy fits you, go ahead, call the number on the screen, and we'll be able to assist you with Dr. Brian or someone close by for shockwave. We also do shockwave in our clinic. So again, if you thought this podcast, you gain some expertise or information from it, go ahead and use it or share it. But thank you for joining the Healing Wellness Show, and go ahead and subscribe on the Spotify or Apple Podcasts, and also follow us on social media for behind the scenes clips and also patient stories. I'm Dr. Karim. Stay well, move better, and we'll see you next time.